We hear a great deal about small intestinal bacterial overgrowth, commonly known as SIBO, but it's actually been around for quite a while. It was first recognized, probably a good 100 years ago or more. I remember reading about it in a gastroenterology textbook back in the late 70s. And I began to teach about it around 1990, about the same time I began to recognize it more and more in patients. And now there's all kinds of small intestinal bacterial overgrowth specialists and products. It's become something which is really quite in vogue. Let's take a brief look at this today. What is small intestinal bacterial overgrowth? This is when the small intestine, and specifically the duodenum, which is the first portion of the small intestine after you exit the stomach, it is normally pretty close to sterile. There aren't any bacteria living in it normally. If there are, they're very few. And in certain circumstances, bacteria from lower down in the GI tract, from the lower portions of the duodenum and the next portion, the jejunum, can what we call translocate. They can move upwards and they can start to colonize the duodenum, and they shouldn't be there. And when they do get in that area, they can cause a great deal of mischief. They can cause a great deal of disturbances. They can cause problems with the activity of bile and digestive enzymes and cause an enormous number of symptoms, because this is one of the first early steps of the digestive process. You chew the food, you swallow the food, it mixes with hydrochloric acid, it comes in the small intestine, and then at that point we have the production or the secretion of digestive enzymes along with sodium bicarbonate, and we get this whole digestive process going. And if that digestive process in the duodenum, which I sometimes refer to that area as Grand Central location, Grand Central Station, because it is such an important area, you can get a wide variety of symptoms. An overgrowth of bacteria, small intestinal bacterial overgrowth in that area, can result in skin disturbances, a huge number of digestive disturbances, bloating, constipation, diarrhea. It is associated certainly with irritable bowel syndrome. It's associated with inflammatory bowel disease. It's associated with a wide variety of skin conditions, fatigue, fibromyalgia, a wide variety of rheumatoid diseases. It doesn't mean that it causes all these things, but it is associated with them at the least. Now, we learned about a little what it is, but here's where really we need to make a point. Small intestinal bacterial overgrowth is a symptom. It's not a cause of itself. And therefore, if somebody is simply to treat small intestinal bacterial overgrowth, or SIBO, by administering antibiotics, which is commonly done, or by administering antibacterial herbs such as oregano oil or neem oil, or garlic, or other herbal products, you can bring about an improvement in symptoms temporarily, but you're just treating the symptoms. You're not really addressing the causes. What are the causes? Well, their causes are very, very, very diverse. They're very individual, and it's really important to understand not only does the person have it, which can be identified through a breath test, where we have the patient take a little bit of a sugar into their system under specific circumstances, and then the patient will actually give breath samples over a period of time, and those breath samples can be analyzed for either hydrogen and or methane gas, and we can determine by the amount of hydrogen and or methane gas that they're secreting, that they're exhaling, how much bacterial overgrowth they may have. What are the common causes of this bacterial overgrowth? Well, we already said it's translocation of bacteria, but what would cause that to happen? Wide variety of different things. One of the most common things is when the hydrochloric acid is not sufficient. And we have this hydrochloric acid in our stomachs, and it normally will sterilize the contents of your food, or what we call chyme, as it mixes with the digestive juices as it comes down. So when that chyme, or partially digested food, enters into your small intestine, the duodenum, it's already, most of the bacteria have been destroyed in it. But if we have compromised the hydrochloric acid, then we're going to have a lot of bacteria ending up in the duodenum, and that will cause that interference, that small intestinal bacterial overgrowth. Why would we have a deficiency of hydrochloric acid? Well, for a number of reasons. One is just as we get older, that amount decreases. But much more common than that is the use of H2 blockers and antacids. And people are given these by medical physicians for a variety of different reasons, usually because they have acid reflux or some other factor. And they're given antacids or H2 blockers in order to minimize their acid secretion. Well, therefore, their food doesn't get mixed properly with hydrochloric acid because the hydrochloric acid is lacking. And then we get small bowel overgrowth of bacteria because there's not that hydrochloric acid in the duodenum to inhibit bacterial growth. There's a wide variety of other reasons too. There can be the misuse of antibiotics where they've been used repeatedly, and that can set up a situation down there in the duodenum where it becomes ideal for other bacteria to come up and colonize that area. There are many other factors that can be involved with that too, and I do mean many. And it is extremely important, rather than just to go in there and kill bacteria, just to treat the person's symptoms, to find out by a really thorough case history, family and case history, what may be causing that problem in the first place. And from that point forward, once we remove those causes, whatever they might be the person's not getting enough sleep, might be the person is eating things they're allergic to, might be the person is overeating, might be the reason the person is drinking alcohol, might be that the person is under a great deal of stress and their digestive juices are not flowing as properly. Many, many reasons. We need to identify what those reasons are, address those reasons, and then help the body naturally to get better. Now, does giving antibacterial herbs ever play a role? It can be used, but it should never be done by itself. We always want to find out what were the original causes that led to that bacterial overgrowth, and once we get those addressed, then we can kind of finish up with a few things to give the patient some comfort as their body restores itself. But we don't want to make the use of antibiotics. And there are some antibiotics, of course, that will kill those bacteria too, such as rifaximin or xifaxin. It's a very potent antibiotic in terms of its ability to disturb or to destroy bacteria that have overgrown. The problem is, as soon as you discontinue it, the bacteria come right back again. So we really haven't accomplished anything. So we identify why the person has that bacterial overgrowth to begin with, and that means a thorough physical exam, a thorough case history, examining all portions of the patient's life, and appropriate laboratory testing, which might include a SIBO test. And if we do those three things, identify the causes, remove the causes, and then we support the body as we restore normal homeostasis. And that is the appropriate way, which we do at the Goldberg Center Clinic, to address SIBO.